Good morning and welcome everyone to the Ontario Monthly Webinar Series 2024-2025. My name is Shanti Aguilar Cardenas and I'm a research assistant with the Ontario NEIHR. I am from Treaty 1 territory and of mixed ancestry from what is now called Guatemala in Central America. Today, we are accompanied by Dr. Holly Graham, who will be speaking about CPR racism, a guide for healthcare providers to address racism in healthcare. And we're also joined this morning by our elder and knowledge keeper, Clayton Shirt, who will start us off with a spiritual opening. So I will pass it over to you, Clay. Miigwech, Clay, for that beautiful opening and for getting us started in a good way. So before we begin, I just wanted to note a few items. This webinar will be recorded and posted to our YouTube channel. So please feel free to share this with your networks and with anyone who couldn't join us live today who wanted to be here. We will also be administering a survey that will appear in the chat box at the end of the webinar. If everyone could please take a few moments to fill that out, that would be greatly appreciated. And if you don't get a chance to today, it will also be sent out tomorrow via email. So thank you very much in advance for that. So I'll now take a moment to introduce our speaker, Dr. Holly Graham. So Dr. Holly Graham is a member of the Thunderchild First Nation in Saskatchewan. She has worked as a registered nurse in northern communities and various other healthcare environments since 1985. Currently, Holly is an associate professor in the College of Medicine, Department of Psychiatry at the University of Saskatchewan. She also maintains an active practice as a registered doctoral psychologist, working primarily with individuals who have experienced trauma and symptoms of post-traumatic stress disorder. Holly's research is strengths-based and with a focus on Indigenous health, mental health, and wellness. She currently holds an Indigenous Research Chair in Nursing, awarded by the Canadian Institutes of Health Research, Saskatchewan Health Research Foundation, and the Canadian Nurses Foundation. Dr. Graham's research chair, entitled Wakotuin, We Are All Related and Interconnected, will support and mentor undergraduate and graduate nursing students to engage in advancing reconciliation within nursing practice, research, education, and administration. So, miigwech for joining us today, Dr. Graham. I'll hand it over to you.
Thank you for that introduction, and thank you, Clayton, for those wonderful words to open up in a good way. It's always good to start the morning with a prayer, and I so appreciate that, so thank you very much. I just want to give, just make sure that we've got the PowerPoint up here. A little bit of context of, I'm not sure that you're seeing what I'm seeing.
We can see it. It's all good.
You can? Okay, awesome.
Thank you.
Yeah, so I'm going to give a bit of a context of where I come from and the work I do. And we're going to watch a 7-minute video and then a little bit of history, and then we'll get into the CPR racism guide. Just having a bit of a freeze here. So I just wanted to acknowledge the land that in Canada we live, we learn, we work, and we play on traditional Indigenous territories, and to pay our respects to one another, First Nations, Métis, Inuit ancestors, and to affirm our commitment to respectful relationships with each other and with the land. This is a picture on my maternal side. I'm Cree and Scottish. My mother's Cree and fluent in her language. We're from Treaty 6 territory. And this is a picture of my grandfather, Pete Wapass, and my great-grandparents. He did not attend residential school. His parents hid him. And so he was a very traditional, kind, gentle man, very much an anchor in my life growing up. My grandmother, on the other hand, did attend residential school and was certainly traumatized by the experience, as the rest of my family was as well. This is a picture of my mother and my uncle when I finished my PhD, and just the excitement. And they said, "So now what are you going to do? How are you going to address these health disparities?" And so that's really being born into Indigenous health and working in it as a nurse and as a psychologist. It is a top priority. So we all know and have been exposed to much literature that describes that colonization has been devastating for First Nation Métis Inuit peoples. And with the TRC calls to action in 2015, there's been calls to how all Canadians could start to redress this history, learn about what happened to Indigenous peoples, and then to create space and place for Indigenous peoples to be in all the fabric of Canadian life. So a couple of things I've done with my chair is to create awareness about this history, and then the tools I'm going to show you is another component of that. So as I've said, we have to talk about these health disparities within the context of colonization. So I'm going to show you this video. It's 7 minutes, and bear with me. I'm hoping that we don't have any technical difficulties. And I'm just gonna bring it over. Okay. Just gonna make that larger and a little bit. And just if you could, someone could give me a thumbs up that you can hear and see it before I enlarge it, that would be great.
We actually aren't able to see it,
Current health disparities.
but we can hear it.
Okay, so that was the problem we had before. Let me just see if I take it. Just wondering. We were working with this before and having some difficulties getting it to show.
Would you like me to try sharing it from my screen, Holly? This is Dawn.
You can try.
Okay, let me give it a shot.
There's no sound. There's no sound at all coming through with the video.
Holly, do you want to try maybe one more time? Just because we were able to hear it when we,
Sure.
when we practiced. So
My apologies.
No worries. Let's just see if we can get our this time.
oh, there we go. We can see it now.
You can see it now?
Yeah.
Okay, let's just take this back.
Oh, and now, so now we can see it, but we
Current
can't
health
hear it. Oh,
disparities
there we go. We can hear it.
Okay.
experienced by Indigenous peoples are rooted in colonization. Saskatchewan healthcare leaders are taking action to reduce these disparities and create safer spaces where all people can receive the care they need with dignity and respect.
Canadian colonial history and nursing history will be rewritten in coming years with the truths Indigenous First Nations, Métis, and Inuit peoples have known for many decades.
The current health disparities and inequitable access to health care experienced by Indigenous peoples in Canada must be conceptualized within the context of the past and present manifestations of colonialism. All Canadians require an accurate account of the past and ongoing colonial relationship between the Canadian government and Indigenous peoples to dismantle the systemic inequities such as access, bias, and discrimination.
In the spring of 2023, in the Opinihow Valley of Wanuskewin Heritage Park, Saskatchewan health leaders gathered to solemnly reflect on the legacy of pain, suffering, and genocide inflicted upon Indigenous peoples.
As healthcare providers, we apologize for the cultural genocide committed against Indigenous peoples and acknowledge that the healthcare system and nursing education programs are embedded with colonial hierarchical power structures, thinking, and practices. We must collectively commit to learning their truths and our Canadian history to develop authentic, meaningful, and respectful relationships with all Indigenous peoples.
Reconciliation requires recognizing this colonial history and for all nurses to respond to the Truth and Reconciliation calls to action. As nurses, we are committed to including First Nation, Métis, and Inuit perspectives and ensuring their knowledge systems are honored, respected, valued, and integrated into nursing practice.
The nursing community in Saskatchewan acknowledges that, as healthcare providers and carers, that we have a history of causing harm to Indigenous people. We are committed to educating and supporting registered nurses to identify racism that is perpetuated in healthcare settings, and more importantly, to support registered nurses to intervene, to ensure safe environments, and to address acts of racism within their workplaces.
We reside in the traditional lands of the NEIHR, Nakawewak, Nakota, Dakota, Lakota, Dene Chipewyan, and the traditional homeland of the Métis. As members of this land called Saskatchewan, we live and work in treated 2, 4, 5, 6, 8, and 10 territories.
It's time to make a turn. A chance to share your heart. To make a brand new start. And walk the way down.
We will diligently work towards addressing the current health disparities between Indigenous and non-Indigenous peoples in Canada. We can begin reconciliation by answering the calls to care through the calls to action.
I will learn about the history and legacy of the residential schools and government policy that has created the health disparities. I will acknowledge the intergenerational impacts of colonialism on Indigenous health and well-being. I will commit to integrating a holistic approach to health that includes spiritual, emotional, physical, and mental wellness.
I will learn how to integrate Indigenous healing practices into my nursing practice.
I will value Indigenous healing practices and learn how to integrate them into my nursing practice where requested by Indigenous peoples.
I will continue to be an ally, supporting Indigenous nurses and clients within all healthcare environments.
I will take action to dismantle systemic racism in healthcare, starting with my own practice setting.
I am committed and dedicated to working with other nursing leaders within Saskatchewan and beyond to effect positive change within the healthcare system to make it more equitable and culturally safe for all those that are in need of care. We will support truth and reconciliation by fostering collaborative relationships with First Nations, Inuit, and Métis peoples.
With your help as Indigenous people, nurses can learn from your stories, your strengths, your courage, and guidance as we walk in partnership towards a time of understanding and compassion to make a change.
Together, we are responding to the Truth and Reconciliation calls to action and will create positive change for the people of Saskatchewan.
Relating the past to today, the acknowledgement was made that systemic racism still exists within Saskatchewan's healthcare system. The commitments made by the Saskatchewan health leaders are in response to the 2015 Truth and Reconciliation Commission report. The report included 94 calls to action to begin dismantling systemic racism devastating Indigenous peoples in Canada. The calls to action address the areas of child welfare, education, language and culture, justice, and health. More information on how you can begin to address the health disparities Indigenous people experience are available at the National Center for Truth and Reconciliation and the Indigenous Nursing Professional Practice Group.
Well, I'm glad we finally were able to get that to work. So that's always wonderful when that works. So I want to double check. Can you see the screen, a commitment to truth and reconciliation?
No, so right now we're just seeing the Zoom screen.
Okay, so what I am going to do.
If you do a share and unshare and share again to choose the other screen.
Sure. Okay, can you see the slide now?
Yeah, we're all good to go. Thank you.
Wonderful. So hopefully we'll be on track and there'll be no more technical challenges. And I wanted to share this video to start the discussion this morning about the work that I do and continue to do as it relates to the chair I have in nursing. So there were 6 chairs awarded in Canada. It'll be 5 years ago in September. And we partnered and we networked and we worked together. And we worked with the Canadian Association Schools of Nursing, which are the regulatory board nationally for all nursing schools. And we were successful in having Call 24 being required for accreditation for all nursing schools in Canada. So that means going forward that all nursing schools, whether it's a LPN, RN, NP program, they'll have to learn about the history of Indigenous peoples, the legacy of residential schools, UNDRIP, treaty rights, Indigenous teachers practices, but it also talks about skill-based training. We always have had training in cultural competency, but they've added conflict resolution, human rights, and anti-racism. So that has been a real change. And so I wanted to create this video and I partnered with the Saskatchewan Regulatory Board to help with the gap in knowledge with practicing nurses and new nurses graduating. Many nurses who have been out in the field are not aware of the TRC calls to action. And since our new nurses will have this knowledge, that's why this video was created to bridge that gap. So this has really informed much of my work that I've done in the chair, and racism is something that I have prioritized right from the beginning and has really fueled much of the work I've done. Because the past does impact the present, and we look at Indigenous peoples, we know every document, report you pick up that they experience poor health, higher rates of poverty, violence, and are overrepresented in our justice and correctional system. When you look at just the toll of being Indigenous, just, I was one night just kind of Googling and looking at some of the headlines. It's talking about failed promises, broken promises, looking at being profiled and targeted when shopping, and right up to when our relative Joyce passed away. And I'll talk a little bit more about that. Of course, there's been many calls for including all voices and bringing them to the table. And I think that we're still advancing ways of to do a better job. We can do much better in nursing of including people that we provide care for.
I'm sorry to interrupt you, Holly. I'm seeing your display. I'm seeing both your current slide and the next slide showing. So I think I'm seeing your display. So if you can go up to display settings at the top there and just make sure that you're in presenter mode.
Okay, so what is really unusual here is I'm not seeing what you're seeing. So,
Okay.
so I'm
So
gonna reshare
apologies,
this.
but I did want to make sure that you were aware of that. Okay, and then slideshow.
So for whatever reason, I've never had this type of difficulty before.
Okay, if you want to scroll down to the slide that you were just at on your sidebar.
Okay, can you see this?
Yes, there it is. Yes.
Are you seeing the next slide as well, or no?
Yes, I am.
Okay, I can't seem to get rid of that.
Okay, at the top of your screen here, can you show look at the little arrow that you should see show taskbar, display settings, and slideshow? Do you see any of that at the top of the screen? So just to the left or to the right of that, there's just the display settings and an arrow.
No, actually, usually I have no problem just putting it in presentation mode, so I'm not sure.
Yeah, okay. Well, if you want to, I'm sorry to interrupt about it, or I'm not 100% sure.
Is that, no, it's, I'm just going to continue. I think it's probably not as important as just getting through the content.
Okay, yes, my apologies. My apologies. I just wanted you to be aware that we were seeing that.
That's fine. That's fine. So with this new requirement, there's been a change in nursing education, and there's been a real call for all Canadians to learn about this history. And we know that this past has continued to impact the present, and that these health disparities really have continue to grow. In fact, in some cases, I'd say since COVID, are actually worse when we look at the opioid crisis, the suicides, and much of the violence. And often when I'm teaching, I get the question is, why focus on Indigenous peoples? And I would say that with the trend towards EDI, equity, diversity, inclusion, I always put capital I first, because Indigenous peoples are separate. No other group in EDI or people who have immigrated to our country have the unique socio-political history that our First Nation Métis Inuit peoples have with the federal government. The federal government has created policy deliberately designed to annihilate Indigenous peoples. And with these structural policies of racism that have began since contact, these have rooted the health disparities, and no other group of people has that claim in Canada. And that's why we have to separate Indigenous peoples. We know they don't have the same health, and that much of it, all of it, stems from colonization. So this history is what people need to be aware of, and so that it can stop perpetuating victim blaming, and that to know it's not the only place it's happened. This has happened globally all over the world. And so it's important that this history is captured. I just want to talk about the doctrine of discovery, because really it's the basis for Canadian law. And this is the international law that actually allowed vacant land that could be discovered if the peoples were not Christians, because if they were not Christians, they were not humans. So right from the doctrine of discovery, when Canada was landed, by the explorers, Indigenous peoples were not considered humans. And this has set the stage for racism that has continued and perpetuated. And the processes through the Indian Act have allowed this relationship to continue. And the Indian Act clearly specified who's Indigenous, who's not, and had much of regulations about what Indigenous peoples could and could not do in every aspect of their life. We know that colonization includes like epidemics, the residential schools, Indian Act, Indian hospitals, the 60 scoops, and we can see how that has played out in today. I'm going to focus more on the Indian Act because that is really relevant to why I mean the Indian hospitals, to why I wrote the CPR racism. If you're going to read one article or book about the experience, this was written by the survivors. We know that trauma impacts people. We've had the research since the mid-90s of a longitudinal study of adverse childhood experiences, and these experiences were actually evaluated on people who were well-resourced. They were white, middle class, living in the United States. And what they found is the more adverse childhood experiences they had, the more risk there was for other conditions. And these are just the 10 situations that they look at that had to occur before you're 18 years old. So if your parents divorced, that would be 1 out of 10. The problem and the concern is when you have a score of 4, so 4 out of 10, and you can see the increase of conditions are substantially multiplied. So there is this link between childhood trauma and chronic diseases, and this is important for nurses and healthcare providers to know, because when we look at the Indigenous populations, we have higher rates of endocrine disorders, diabetes and cardiovascular, heart disease and stroke. But much of this can be linked to adverse childhood experiences. So if you link that with the experience of colonization, children being removed from their home and experiencing those types of adversity, we can begin to understand some of why we see the huge gap in health disparities. When we look specifically at Indian hospitals, Gary Geddes and Maureen Lux wrote these 2 resources, and they brought to attention for what many Canadians are not aware of, the degree of experimentation that was done, nutritional experiments, deliberate starvation. They were actually published by the Canadian Medical Association, which is actually shocking that they would think it'd be okay to publish and make it public what they had actually done. And it continues to go on to describe that these Indian hospitals were underfunded, understaffed, overcrowded, and lots of coercion, medical experimentation. They were also funded at half the cost of provincial hospitals, and this racist structural form of funding was not only in Indian hospitals, but also continued into education until about 3 years ago. So until about 3 years ago, our First Nations schools were also funded at 50% compared to the rest of schools that we have in Saskatchewan. So you can see how First Nation peoples have been disadvantaged when we look at even just starting from K to 12 education. Indian hospitals, there's much literature, growing body of literature about the forms of treatment, the abuse, the neglect, the coercion, and just lack of autonomy, what happened. Unforgotten is a great video, and it talks about Charles Council Hospital, which is in Alberta. And there's currently a $1 billion class action suit against the federal government in place right now regarding these Indian hospitals. There was lots of experimentation. Actually, in Saskatchewan here is where they did the experimentation with the BCGs with looking for TB. So we can't deny that there's been this historic trauma. When you look at the demographic collapse, the 90 to 95% of Indigenous population was wiped out within 2 generations of contact. And then the onset of diseases, forcing of religion of one group onto another, proselytization, the famine, starvation. So there's no denying there's this historic trauma. There's no denying that this history affects the present. And when I think of my relatives, there's my mother on the far right. And this was the first day at Wanascale in the first year when they made September 30th a national holiday. And she spoke about, I guess, the gratitude that others could learn about her experience and what happened to them, and that Canadians are interested in learning this history. And it excited her because she said this should never happen again. And those are my brother's children, so my nieces, my daughters, and grandchildren as well. Very proud to be who they are. So when we look at what's happened to Indigenous peoples, and continues to happen, and in addition, when we overlay it with COVID, COVID was difficult for everyone. Everybody in the world suffered through COVID-19. But when we look at Indigenous peoples, not only did they have the health disparities, the difference in housing, unsafe water, less living more likely in poverty. So they had to deal with COVID like everyone else. They had to deal with the unmarked graves being made public, and the shock that created in our country, and also the settlement for the day schools. So when we think about the constant trauma and the constant unrelenting trauma that Indigenous peoples go through, it hasn't stopped. And I think that's what's really important for people to take away when we're talking about Indigenous health and wellness, that colonization is not in the past. Its legacy is well alive and happening in every day in healthcare and in other settings in our country and worldwide. This report was released and it talked specifically about what's happening in BC with Indigenous people's experiences in healthcare. And it also highlighted, in a nutshell, that many Indigenous peoples were fearful of going for care, fearful that they may not survive. So racism is a structural system that exists where it gives one group of people value, privileges, and opportunities, while others are oppressed, and it creates barriers. It is a form of violence, and it is a barrier towards equitable health. The push is really to be anti-racist, so that just goes beyond saying I'm not racist. It's actually involves action, identifying, challenging, and looking at the existing policies and practices that are perpetuating racism. The Canadian Association Schools of Nursing, who are our national body that is responsible for accreditation, released their apology where they acknowledged too that nursing education has been inequitable, unjust for Indigenous peoples, and that they have not been always respectful or culturally safe, and at times have provided racist care. And this is part of the recognition of integrating Call 24 as required for accreditation. Is now they're following up with more guidelines. So it's important to know that there is a shift in healthcare that has started. It's been slow, but it's consistently moving towards addressing these changes of inequality. This was a great document. Again, it talks about the same thing. We need change. We need more Indigenous health people providing care. And of course, education and hearing from the patients. So this is the professional practice group I started in Saskatchewan, and it's really to mentor undergraduate students as well as nurses in Saskatchewan, bring everybody together so that we can review documents that go through our professional regulatory board and provide input. So we now have this relationship with the College of Registered Nurses Saskatchewan. So this is the symbol that we designed. There's 4 and 5 petals, which is relevant to the creation story. And Muskegee Isquo is medicine woman, the loose translation. This is a picture of the website, and the video you saw at the beginning where we're having troubles is under nursing and reconciliation, and there's a lot of content and information there. So really back to the death of Joyce that happened in 2020. I was shocked, and I was actually horrified as a nurse of 39 years that something like this could happen in any day and age, but particularly in this day and age. And it really prompted me to think about what could I do. And at the same time, after this happened in Saskatchewan, the FSIN decided they had been fielding calls for over a decade of Indigenous people's experiences in Saskatchewan in healthcare. So they actually decided to open up and create a First Nations Health Ombudsperson's office in Saskatchewan to investigate racism. So that has started, and this was spurred on, pardon me, by the death of Joyce. So while this was happening, and I was thinking, and at the same time, I was binging on Netflix, and I was watching Grey's Anatomy. And for those of you who've ever watched it, it was just always someone's coming through the ER doors and CPR. And I was just thinking, you know, I think I need to write something that has CPR racism. And I chose this title really just to underscore the fact that Indigenous peoples are dying as a result of racism. And we all understand intuitively that CPR is about saving lives. So that was why I chose that. And it's not meant to use in an order. It's not a linear fashion. It's components of a overall intervention. So I really looked at having something that could assist people to intervene. And really, when I look at like why I provide it, it's just people were coming to me and saying, how do I teach it? How do I teach my students? What do I do? What do you recommend? And to me, it was very natural. And for me, it was very comfortable to do this and to intervene. But what I realized is for many people, it is a new concept. In the In Plain Sight report, they also advocated for creating and supporting a speak up culture. And this was part of my thought when I was writing this. It also has laminated cards, which are really cool. And on the back of it has a QR code that people can scan. So this guide is really about facilitating those difficult and necessary conversations to mitigate, you know, Indigenous people's experience of racism in healthcare. And it's about telling people, you know, it's like, call out, how can I help to get involved so you can be engaged, to plan and practice, being comfortable with advocating. It takes time and patience. Review the chart. It's important. By doing your own assessment, you'll be able to effectively contribute to an appropriate treatment plan. And then review the treatment plan. And in a respectful, neutral tone, request rationale from your colleague or colleagues for the current treatment approach. So it's not easy to do, but this is necessary to do to begin to dismantle racism in healthcare. You're going to have to find your own words that make sense for you. So I merely have some suggestions, like, for example, I've reviewed the chart, I've assessed the client, and I'm wondering what is the rationale for the current treatment plan. Another way could be to say is, after reviewing evidence-based practice for these presenting concerns, it seems like we're missing XYZ here. What do you think? Or as a nursing student, you could say, please help me understand the evidence for this type of approach. Or just very simply, what are the goals of this current approach? These are just simply questions that will encourage healthcare providers to think about their thoughts and practice, and perhaps kind of look a little bit at their underlying beliefs behind their thinking. Allyship and advocacy, it's really important that we educate ourselves and that we get support and know that it's a lifelong process of building relationships that's really based on trust and accountability with our clients. Check with the client. It's really important that you check and verbalize your position. Like, are you okay? I believe you. I'm here if you need something. I will check back with you. You want to become the safe person and really to establish that therapeutic relationship. Always intervene. Be an active bystander by using this guide. And it's important that we speak up. And we have to speak up to a nursing manager or the clinical educator of the unit regarding your concerns, and to seek support for yourself. This takes courage, and finding support from a colleague or colleagues or a mentor can also help you through this process. And lastly, it's just really about modeling safe, competent, compassionate, kind, ethical, trauma-informed care in all interactions, because trauma, unfortunately, is a common experience among all Canadians. So that was really my goal, and I wrote it just the way I teach it. This guide, it's rooted in our ethical nursing values and our standards of practice, which standards of practice are pretty similar across Canada. And the Canadian Nursing Association Code of Ethics are actually for all nurses in Canada. And I've also created a Good Medicine People Lab, Mi'omuskegee-Innuwak, at the University of Saskatchewan here, which centers around the 7 sacred teachings of the humility, bravery, wisdom, honesty, truth, and respect and love. And this CPR for racism will be made into a lab and experiential where students can practice doing an intervention. and there's just some of the clothing. So in order for this to happen, to reduce the health disparities for people to recover, we really need change in all levels of society and within our government and all Canadians. Those who've been oppressed require healing and recovery, and those who continue to oppress also require healing and recovery. So I apologize for going through that quickly, but we lost some valuable time with the technical challenges. I'm going to stop sharing and look forward to discussion. We probably have at least 10 minutes. We started a little late. And I can actually I should put the article, or perhaps someone there at the Institute could put the article in the chat box for everyone. If you're interested in having a laminated copy of the CPR racism card, then just send me an email and with your address, and I can mail one to you as well. So, any questions, comments, or feedback would be greatly appreciated. Okay. See two in the Q&A. Yes, the paper has been published that I wrote this, so I'm not sure. We can send it out to everyone. I can make sure that it's emailed to all the participants. Because the paper, or if you just Google CPR racism Holly Graham, it's published within the International Journal of Indigenous Health. So those are the two questions in the chat box.
It looks like somebody had raised their hand as well, but now. Okay, I'll let Michelle Spadani ask her their question.
Sure.
Hi, Holly. As I was listening, I was thinking about how it's so nicely aligned, your visual and your conversation about bringing it across to ethics or moral action and the standards of practice. And I think for students, that's one of sometimes the challenges. They don't always connect those pieces together. And particularly in their first and second years, and of course, we're working with larger groups of students now, and some of our students are from all over the world. And I think this might actually be very useful. I read your article because we have students coming from other countries, and sometimes they'll say to us, like, why do we have to really connect this history? It is, and now we're moving on. And we're like, but no, let's back that up. So I think it's going to be useful in our teaching process with students, because not all students are starting in the same space.
Yes. Thank you, Michelle, for that. And that was exactly why I wrote it very simply, was to be useful for all practicing nurses and for teaching students. And you're right, it's rooted in our ethics and our standards of practice. So it's not a new concept. What I think is original is how I brought it together with CPR racism to draw attention to it. But if we were all practicing according to our ethics and standards of practice, there would be no racism in healthcare. Joyce Eschequantz would be alive.
Yes. Yeah. And I think that's helping students to get there and make those connections, and also to look at our environments to see what breaks down along with the person when an event like that happens, when somebody is lost to racism. So that, because sometimes they'll say, well, that was just that nurse, but there's way more than that going on. So I think that your writing opens that possibility up for a broader conversation with the students.
It does, and you're right, there's a lot more going on, and there's a lot deeper. This is about the fourth presentation I've done, and I've literally had nurses like burst into tears and tell me some of the things that are happening in their hospitals. And I've encouraged them to go back with the guide and to meet as a team, and then I'm happy to come in and help them to work towards how they can address it in the workplace. And any of those of you who want the CPR card, like just send me an email and I will mail it out to you. Please use the resource, share it with anyone you want. It's, you know, I've seen some of the questions. I'm happy for that to happen. In fact, that's why I created it. So thank you.
Let me share it with my instructors and have them maybe drop it off on the wards.
Sure, sure. I know we'll be doing some sort of release of it in Saskatchewan. I'm just meeting with the regulatory board. And we're not sure if we'll do a hybrid of mailing some in person or for sure the link. But definitely. So thank you.
Drop your article off. Just put it out there. Thank you.
Yes, thank you. Nicole Johnson had asked, it hasn't been shared with Indigenous Services Canada because I've just recently published it. It's like less than a month ago. But if you would like to share it, feel free to share it. And yes, Nicole, we can certainly give you a copy. Just send me an email. So the question is, do you think it's ever possible to eradicate racism due to colonization or any other historical background? I don't think so, but I think we all have biases and things that we feel about ourselves and others who are different. But I think if we actually make it so that all healthcare providers and people in positions of power when people are vulnerable are abiding by their codes of ethics and the regulatory boards stand behind that, then we will have safer care for everyone. And I think that is the key, is given the history of what's happened in the world and continues to happen. But I do think that the more people who are aware that it's, you know, we all say, oh, the bad things are happening in other parts of the world. Well, this is a bad thing that's happening in Canada, and people are dying right here as a result of it because they're not seeking care because they're afraid of how they'll be treated. That some of them are afraid they'll die in care. And that's why they often come with family, and much of their family is because they don't want to come alone. So absolutely. You can post my email. I did put it in the chat box here. But you can certainly post my email.
Okay, great. I've shared, yeah, your email with everyone there.
Any future events or seminars you're participating, we should be aware of. I'm doing a plenary at the Canadian Federation of Mental Health Nursing Conference in the fall. I'm speaking at the Canadian Psychological Association actually this week at the national conference, but that's closed. There's always a lot going on. But if you guys want anyone to email about kind of when I'm developing that lab to teach the experiential opportunity to apply to CPR racism, if you're interested, once I've developed that, I'd be happy to share that so you can implement that in your own nursing schools or wherever you are. Any other hands? I can't see any hands.
Oh, yes, we've got one hand. It just came back up.
Sure.
Oh, maybe not. We have another minute if you did want to ask your question.
Hi, I would like to ask a question.
Sure.
When I've been teaching students for the last 30, 40 years, and what it matters while we can give all the knowledge, really it's not sufficient enough to change their behavior. Okay, and also the knowledge in student learning, I also learned that it's the tail wags the dog. And unless there is an examination or some kind of evaluation, the student don't learn, unfortunately. So I was wondering, how have you made any kind of inroads in ways to make sure we change their behavior?
Thank you. And I agree with you. It has to be role modeled in nursing education. It has to be role modeled in healthcare settings. And it is true, if students aren't supported and given the skills and then have time to practice it, that's why I talked about this lab I'm creating, they're less likely to intervene. And also there's the power dynamics because they are a student. And when we have clinical instructors going to hospitals, they're actually guests. So there has to be a more systemic approach, which is why I'm working with the regulatory body in Saskatchewan, who is also working on an anti-racist document, which is going to be sent out and mandatory in this province in Saskatchewan. They have been my best allies. They have been absolutely phenomenal. They took the anti-racist education that I had partnered with the Saskatchewan Anti-Racist Network in the first 3-4 years of my chair. I did massive education of anti-racist education. They all took the training and they made it mandatory for everybody in their office to take the training. And they have completely come on board. They supported the video and worked with me. And so I agree with you. It's not enough just to expose students to this. We have to role model it ourselves. We have to stand up ourselves. We have to intervene. And we have to stand behind our students, pardon me, when they bring a concern. And we have to practice with them. And that could be pre-conference, post-conference when we're teaching. But the ethics are very clear in the codes of nursing. And so there really is no leeway for people not to be following this guide. This is just merely highlighting how the nursing practice values and standards, if done, would mitigate racism in healthcare. So thank you for that question.
Yeah, but also you have to reinforce from time to time, because one-time learning does not, because the nursing students are inundated with thousands of other facts and behaviors and attitude change and so forth. So unless this is reinforced so often, my sense is that a lot of time we are kind of in wilderness, really, to be honest.
I agree with you. I think that's for many concepts. So I think that's why we're talking a systemic societal change, that if all nurses are operating and practicing within the CPR racism guide, then there's going to be that constant mentoring and role modeling that all nurses and nursing students will see. So thank you.
Thank you.
There's one comment. What is one message you would like our nurses to take away when receiving education in our schools regarding Indigenous peoples in Canada? I would just say all people require and deserve safe, competent, ethical, trauma-informed nursing care. And if we did that to all peoples, all our Indigenous peoples would benefit. Indigenous peoples don't require special care compared to other people. I'm talking about equality right now. I'm not even talking about equity. So I think the concept of safe, competent, ethical care for all peoples is what I'm advocating for, but drawing attention how Indigenous peoples have not received that, and it's rooted in colonization. So thank you for that comment.
All right. Well, we are a little bit over time, and it looks like we've reached the end of the questions here. So I'd like to just take a moment to thank you, so much, Dr. Holly Graham, for sharing your knowledge. And yeah, on behalf of the Ontario NEIHR, we just express tremendous gratitude for joining us today. So I've shared your email there if folks want to get in touch with you, and we can definitely send out that article as well. So I'll pass it over to Clay to do our spiritual closing.